exam, part 2. So we already talked about vital signs, and we took a little break there, which is important to do at home also. If your dog is getting stressed out, whether it's at the veterinary hospital or at home, take a break. They're like a kid. You don't want to push them. You don't want to stress them out unnecessarily. We are now using treats to make sure Lloyd hangs out with us for the rest of this exam. So starting with your physical, you can either do it in a systems-based approach, meaning thinking about the heart, thinking about breathing, thinking about their vision, their ears, thinking about systems, or you can do starting at kind of the nose and the head and going towards the tail. For this video, we'll start with that approach, but start to play with whatever works well for your pet at home. There's no right or wrong. It doesn't really matter. You just want to make sure you're evaluating them fully. So, good boy, Lloyd. So we'll start looking at Lloyd's face. So I'm looking at his eyes. Can use a treat to help him focus. I'm going to look to see, are they both symmetric? They're both nice and open. They're clear. There's no discharge, so he's not tearing. He's not showing any redness on the white part of the eye. And one eye isn't squinted or anything abnormal like that. Similarly, if you noted any swelling, is one eye kind of bulging out? Looking at his nose and at his muzzle, I don't see any discharge. There's this rumor out there that a dog's nose should be wet. That's not really a thing. You just want to make sure that they're not having drips from their nose. That might mean allergies, might mean something's in their nose, might be something like a growth or a foreign body, something that shouldn't be up the nose, like they sniffed something in their mouth, in their nose. Next, I'm going to look at his mouth. So for this, might be a little hard for video purposes. Come here, kiddo. But give him a little treat there. You can quite literally feel along their jaw. See, is anything hurting? So if they have a tooth issue, sometimes just feeling along their jaw is going to be uncomfortable. If they're focused on treats, it's going to be hard. But you can also just go ahead and open their mouth. Good boy. As long as they'll let you do it. What I do is I put 2 fingers on the lower jaw right behind the canines and 2 fingers on the upper jaw right behind the canines, and you can open their mouth like that. If they're a dog that does not like their mouth touched, forget about it. That's normal for them. You don't need to go in there and be too aggressive, but just a way to start getting an idea of what's normal and what's going on with your pet. Now, next thing is to start examining their ears. So you can feel at the base of the ear and see, okay, you want another treat. We're doing a treat first. Then you can feel at the base of the ear and massage. Make sure that's not uncomfortable. If they whine, if they whimper, if they move away, there might be pain or discomfort there. Not to be gross, but sometimes you can smell something funky going on. So if you do actually just go ahead and smell, just, not too close, but just like that, to see, does it smell kind of like Fritos? That can be a sign of yeast. It could also be a bacterial infection. Do not stick anything in their ears. Do not go digging in there with a Q-tip. You can cause trauma, you can cause issues. Go to your veterinarian or at least give them a call and see what they would recommend. If your dog has ongoing ear issues, they may recommend cleaning it. Again, just do not stick anything down there. There are certain things that you can squirt into the ear as long as it's pet safe. And then you can actually just use cotton tip, like normal little cotton balls, to just clean at the ear base. Just don't go deep. Next, we can start actually feeling on their neck. So feeling right here in the front of his neck. In small dogs, if you squeeze there, sometimes they may cough. That can be normal for some dogs. Little dogs can have an issue with their trachea, their windpipe, where we call it collapsing trachea, where it's very sensitive to palpation, and you palpate and they cough when you do that. So don't be aggressive when you feel their neck. If you're feeling very lightly and they start coughing, it might be a reason for concern. But again, the main point of this physical is just seeing what's normal for your pet, seeing if there's something that's bothering them. Really important in the neck are lymph nodes. Lymph nodes are part of the body's response to infection. They get large when the immune system is activated. Lymph nodes in pets are located just below their jaw here. So in Lloyd, that's right here. So at the base of his jaw, I'm feeling and gently just palpating with my fingers, feeling to see, do I feel that? It should be symmetric on both sides and pretty soft. If it feels really hard or large, that's not normal. It's something to let your vet know. The other lymph nodes that you're going to find up in this region are just in front of their leg, their front leg here. And so you're feeling that. It's called the prescapular lymph node, or just in front of the scapula bone. So that's another thing to be feeling for. Now, the rest of your physical is often done actually when the pet's standing, but for today we'll just continue on because Lloyd is being a trooper. So you can feel along their legs and make sure that nothing hurts, nothing feels swollen. What's really nice is that dogs have 4 legs. You can feel both front legs, make sure they're symmetric, and make sure that nothing hurts. Between their paw pads, if they're limping, did they step on something? Is a paw pad abraded? Is there a issue between the paws? So taking a look at that. Good job. After feeling along their legs, making sure you don't see any signs they're limping, you can also feel their belly. So, hey Lloyd, some dogs love belly rubs. Do you want to roll over? I don't know if you'll do that right now. Down. Good boy. Roll over. No, not right now. That's okay. So we're gonna feel his belly, and you're just petting and gently feeling. You're not pushing too hard, making sure it doesn't seem distended, or again, that one area isn't tender. Those just might be ways to help you better understand. You can go, kiddo, we're pretty much done. Those are ways to help you better understand if your pet is acting off, is acting lethargic, doesn't want to eat. Those can all be signs of pain somewhere in their body. So if you can get a little better idea of where they hurt at home, when you go to the vet and they're starting to be stoic, they don't want to be there, they try to be tough, they just want to go home. Sometimes that's really helpful if you say, you know what, at home, he winced or he moved away from me when I felt his tummy. That can really help them figure out what diagnostics to recommend and get to something, including a treatment, sooner. Thanks, Lloyd.